I just found out I have a 2 centimeter ovarian cyst, and my doctor said that this can be followed for symptoms. Hi, this is Dr. Prati Sharma, double board certified OB/GYN and REI. Ovarian cysts are very, very common in the reproductive aged population. 2 centimeter cysts are on the smaller range. It depends on the caliber of these cysts. Cysts can be simple cysts that often come and go during the menstrual cycle. They can be endometriomas that signify something a little bit more pathologic, like the presence of endometriosis. They can be hemorrhagic cysts, which are more common, especially if you've been stimulating, or they can, in rare cases, be more ominous and be something like a precancerous lesion or a cancerous lesion. So definitely different modalities to evaluate this. Serial ultrasounds to see if the cyst is present in different times during the menstrual cycle, potentially an MRI, potentially doing tumor markers like a CA-125 level. If the cyst is growing or there are symptoms, then there would be a tendency to consider surgical management. If cysts are persistent, especially simple cysts, we consider a cycle of birth control pills to shrink them, especially if the estrogen levels are high and they're preventing you from starting a cycle. However, most benign appearing ovarian cysts can be monitored and watched. We always talk to patients about symptoms of rupture, which is severe pain that can last for a few minutes to an hour, that can resolve on its own or potentially need intervention. We talk about ovarian torsion, which is twisting of the ovary, which can result in intermittent pain and be a surgical emergency. But like I said, most ovarian cysts can be monitored if they are appearing benign, and you can still proceed with your fertility treatment.